Coming up today, strength in the face of cancer. Coming up, how an injury ended up helping this strongman get diagnosed. The radical treatment and his remarkable recovery that surprised even his own doctor. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. In a weird way, it's a good thing Zac Craig hurt his shoulder. Back in 2014, the strongman competitor injured his rotator cuff during a competition. Surgery fixed that injury, but Zac still was in pain, which let him and his doctors realize there was something much more serious happening in his shoulder. Zac is here across from me today to share his story. Good to see you.
Good to see you too.
And he is sitting here with Dr. Howard Rosenthal, an orthopedic oncologist and surgeon at the University of Kansas Cancer Center. Dr. Rosenthal is also the medical director of the Sarcoma Center at the health system. So we're going to learn more about sarcoma, which is a rare form of cancer today. We're going to hear all about Zac's story. So good to see you both. Nice to be sitting here next to each other.
This is very nice. Thank you very much.
When I told you Zac was coming on, you were like, I got to be there.
First thing I said.
I love it. I love that. That's how we get you on. We tell you about your patient. You're like, I got to see this guy. So Zac, it's been 10 years since that injury to your shoulder that we were just talking about. And I have to say, let's show some video, because by looking at the video, okay, I can see where maybe an injury can occur here, okay? Because most people don't do this kind of rigorous activity. So first of all, how'd you get into these strongman competitions?
Yeah, I mean, with the strongman stuff, it's not a matter of if you're going to get hurt, it's when you're going to get hurt. And so through the years, I had been lifting for years, probably since I was 13 or 14, did powerlifting for several years, and then World's Strongest Man on TV, where they lift the Atlas stones and deadlift the cars and pull buses and all that. And it was as simple as, man, that's really cool. I want to try that. And so got into that and had competed in that for about 7 or 8 years. And then the cancer struck.
So you have surgery to fix the rotator cuff. Then you realized that something more was going on in the shoulder. What were you feeling, and how did you know to get seen by a doctor, try to figure it out? Yeah,
so I had rotator cuff injury, like you said, and that happened doing the strongman stuff, and then put it off because I thought I could get through it, and then had the surgery. And then about 8-9 months later, I had a good friend that had it right at the same time I did, but he was really recovering very well, and I was still in a lot of pain. So I just thought I just retore it and somehow didn't know. And so ended up getting another MRI, and I remember my ortho at the time called and said, yeah, we got another issue on our hands, and so you've got cancer in there, and so I'm going to refer you to Dr. Rosenthal. And that's essentially how it stemmed, and then the road took from there.
Well, it's a couple things I'm hearing is that you're right. You're doing this type of activity. You get hurt. You probably are just thinking it'll go away eventually, or maybe a new injury has happened, and so it just goes on and on. So good that you went back in and didn't just shake it off, so to speak. But then you hear the words no one wants to hear. I have bone cancer. Had you even heard of sarcoma? What were you thinking at that time, and what kind of research were you doing?
No, had never heard of it. Had to do my own research, and I remember sitting in a work meeting, and my ortho was like, hey, call me because we got an issue here. I'm like, just text me. It's totally fine. Just tell me what the results are. And he's like, no, you need to call me. And it was on a Friday, and so then he told me, and so then I did my research over the weekend and then called Dr. Rosenthal's office first thing Monday morning.
And you probably got in to see him pretty quickly. So, Dr. Rosenthal, when we say bone cancer, sarcoma isn't always in the bones, correct?
That's correct.
So what kinds of types of sarcoma are there, and what kind did Zac have?
Okay, so first of all, sarcomas are extraordinarily rare. They're the rarest of most cancers. There are bone sarcomas, or those cancers that originate in the bone itself, and I'm not talking about metastatic disease or cancer that comes from another tissue or organ that goes to the bone. I'm talking about cancers that derive from the bone itself. And then, of course, there are soft tissue sarcomas. If you add them all together, there are about 100 different types of sarcomas. If you add all those together, they still represent less than 1% of all cancers. So we're talking about very rare cancers. Zac's type of sarcoma was called a chondrosarcoma, which is a cartilage type of a cancer that's derived of cartilage from within the bone.
So when it comes to symptoms, what might someone feel? And is it hard to catch this type of cancer early?
So it's very hard to catch purely because of the rarity of them. They're not well known. Unfortunately, they don't have specific symptoms. So although Zac had pain, that pain probably was coming from the cancer, but it wasn't until after the cancer had started destroying the bone. In addition to that, there are no blood tests or any other signs or symptoms that we can tell the patients to look for. There's no publicity that we can use to tell patients, hey, look out for sarcoma.
Right. Usually we usually put up a list of here, look for these symptoms, and you can go down and go, okay, I've got 4 or 5 of those, I better go see a doctor. And in this case, not the case.
Exactly.
So what was it like when you met Zac? You have this conversation, and then you got to put together some type of treatment plan. What did it involve?
So the first thing is the diagnosis, and most of the time using appropriate studies, that being x-rays, MRI scans, physical examination, history. We usually have a fairly good idea as to what it is even before getting in there to do the biopsy. I use the biopsy to confirm what I already think it is. In addition to that, we know that the primary treatment for sarcoma, whether it's bone sarcomas or soft tissue sarcomas, is surgical. We do use other treatments, chemotherapy and radiation, but surgery is the primary treatment. In fact, for chondrosarcoma, there's no other treatment. We don't have chemotherapy or radiation that really works well for it.
What about liquid nitrogen treatment? What is that?
Right. So I use liquid nitrogen for low-grade chondrosarcomas. I've used it for a long time. It's freezing the inside of the bone after extraction of the tumor. And essentially what it does is that it enhances the margins. It gets the margins of the tumor resection much better than it would have been from surgery alone. In the flat bones, such as the scapula or the pelvis or the ribs or the sternum, it doesn't have as good an outcome as in the tubular bones, but it's certainly worth a trial at it, because the other option is, and this is what Zac's going to talk about, is complete resection, removal of that entire bone, and the concomitant reconstruction that's required afterwards.
So you do this treatment, this liquid nitrogen treatment, Zac, and you
Right.
think things are going pretty well at the time?
Yeah, so we did it, I think back in 2014, I think, something like that. But we did it, and 9 months later, I thought I was just going in for a routine check, and wasn't having any pain, no signs and symptoms, nothing. Back to training heavy, back to living life, taking care of my kids. But yeah, the CT showed a little bit different.
So yeah, you come back, the cancer was still growing. So Dr. Rosenthal, if the tumor was in the arm or leg, you might consider amputation. Is that correct?
That's correct, although most of the time now we're successful at salvaging the limb.
Which is why you didn't do it in Zac's case. So you find out it's come back. What was the strategy of treatment? How did you have that conversation?
Right. So now we know that we're going to have to resect or remove the scapula. The scapula, or the shoulder blade, is the bone that holds the entire arm onto the body, allows a fulcrum to move it and utilize it and so forth. Reconstruction of the scapula is very difficult.
Complicated surgery, I hear.
Complicated surgery. And in all honesty, unlike a hip tumor in the hip where you can do a hip replacement, or a knee where you can replace the end of the thigh bone, there is no such thing as a total scapula replacement. So they have to be essentially custom designed.
Well, you're dealing with a rare cancer, and now you got a rare treatment.
Right. So in Zac, we elected to do a custom design total, this is going to sound really crazy, but a custom design total scapular replacement, but then we have to attach it to the rest of his arm. So a proximal humerus reverse total shoulder total scapular replacement. That's a mouthful.
I say that 5 times real fast.
And essentially what that is a biomechanically sound construct for reconstitution of the shoulder, both as it looks like a normal shoulder, but also functions as much as possible as a normal shoulder.
So let's see what it looks like. Let's see this description, because this is what it looked like this is the new shoulder?
This is his current shoulder, yes.
All right, so just kind of show us a little bit maybe what we're looking at.
Would you like to describe?
Yeah, tell us what's going on inside there, Zac.
Well, obviously you can see the scapula there, and then the ball and socket joint is flipped, and then there on the right side is the humerus, and that was a conversation that Dr. Rosenthal and I had, because his hesitation was putting that prosthetic in the humerus, because at the time it was healthy bone there. But the conversation we had was, do you want to do that because long term you're going to have a little bit better range of motion going forward if we do that? And we both agreed, all right, we're okay with doing that. And so, and then from my understanding, correct me if I'm wrong here, Doc, he ended up taking all the muscles of the shoulder which form in the tendons, took all those off, and then you can see it looks like pegs there on the scapula, and ended up tying those on and forming scar, and they essentially formed scar tissue on there to hold them on the pegs.
This is what we mean by being your own health advocate. They listen to what you say, and then they can explain it very, very well of what's going on there. How do you feel? How does it feel right now? Does it feel as normal as you kind of remember? Yeah,
so I mean, you know, just like anything, you modify, you adapt, you overcome things. And with this, I don't know that I would say it feels normal, but the conversations we had, even with the humerus taken out, was that the goal was to get it to be able to lift it to about your waist. And so through work, I'm able to lift it to about shoulder height here. And you know, the issues that you have when you go through a drive-through, you got to reach across, or an ATM, you got to reach across, or screwing something in, you maybe have to hold your arm up or pull-ups or whatever. But nowadays, it's just, I mean, it's become second nature, you know?
You've adapted.
Right.
And you shared a photo of the scar after this surgery. I think we'll show you these staples, the baseball, I call it the baseball staples there. But how long did you have to keep your arm immobile? Or how long were you supposed to keep it immobile?
Yeah, I mean, that picture definitely reminds me of baseball stitches every time. But to keep it immobile, it was about 4 to 6 weeks, but Doc was like, hey, take it out when you can. And it was just a matter of pain level and starting rehab as soon as possible, as soon as felt comfortable doing it. And so we got it out, I don't know, maybe I shouldn't say this, but maybe about a week out or so, got it out and started letting gravity take its place and just doing some passive range of motion stuff and moving forward from there.
And I would imagine just going into having a guy who's healthy and you know,
he's motivated.
He's motivated, and yeah, he has a goal. He knows the Strongman has a goal. So we have some questions coming up about your recovery. I want to get to that. And if you're watching live, go ahead and ask your questions using the chat on YouTube or Facebook. You can email the Medical News Network. All that information is right there on your screen. So you two have a kind of a fun anecdote from the first surgery follow-up. Zac, what did Dr. Rosenthal tell you that he was expecting? And then how did you exceed the expectations?
Well, I hope I exceeded expectations, but our first time, he was like, you can get that out of the sling, do your thing, and you can start doing some planks, which is just holding a push-up position there. And I remember I kind of looked at him and was like, what do you think about push-ups? And he's like, yeah, you can do those, but I'm not sure you're there yet. I'm like, ooh, well, I'm up to sets of 20. Is that okay?
So he had already done it. So what are you thinking?
He impressed me the first time.
Okay.
And I remember he got down on the floor of the exam room and demonstrated his capabilities. Yes.
Right there.
The other option, this should be known, the standard of care for a sarcoma in this location usually is to take out the scapula and leave the limb flail. So the limb is still on, but there's really no motion at all. Now the patient can still use their wrist and elbow, but there's really no motion. So going this far, and you'll see how he does, I mean, that exceeds all expectations. Obviously not just for me, but my entire cohort of orthopedic oncologists around the country.
I bet. Yeah, you took physical therapy kind of to the next level, Zac. Just in a matter of months, Zac was back in the weight room. This was post-surgery. So look at you doing this. You know, it's like you said, he was very motivated. Didn't need to be pushed to do rehab. He was ready to go.
Actually, he motivated me.
He motivated you. Yes. I like that. How did you approach your own recovery? I mean, for somebody who's going through this, it can feel very daunting to go, how do I get back to doing the things I love doing? Where did you mentally start with that?
Yeah, I've never really thought about that. You know, naturally, I think I went through all the stages of grief anybody would. And then it got to the point, I do remember sitting on my couch recovering. It had been about a week or so at the time Netflix was a big thing, and so I watched all the Netflix I could possibly watch. I think I found the end of the internet, and I just decided, hey, I got to dig my heels in here and get done what I want to get done. And so I knew it would be a long mountain to climb, but I knew I wouldn't be able to climb it if I didn't just start. And so then it was an extremely tough rehab. Like, I played college soccer, and so when I tore my ACL in college, that was, I thought, a tough rehab. Then with the rotator cuff, I thought that was a tough rehab compared to the ACL. And then this one was just a beast compared to both of them. But it was just like anything, take one day at a time and try and get just a little bit better each day. And then naturally I had my wife and kids supporting me and moving forward, and I had full support of them and my whole family, and so it was just taking it one day at a time and just trying to get a little bit better each day.
Yeah, and I think we have some photos that you brought to show us your two sons and your wife Chelsea, and yeah, so tell us a little bit more about them and just kind of what that I always say it takes a toll on you, but it certainly takes a toll on them as well.
Right. Yeah. I mean, when it happened both times, my wife stepped up, and my parents stepped up, my brother stepped up, and my entire family stepped up and helped out. And then naturally, I think you have a little bit of an ego, and I dropped the ego of letting people help me because I realized that there are some things I just can't do right now. And so it was a point to try and get to that and get back to modifying and get back to quote unquote normal life. But I asked for help, and they stepped up and did essentially anything that needed to be done. I mean, I had a young kid at the time, so yeah, we rolled with that.
Kids under 5, is that what they were? They were young?
Right, yeah, they were very young at the time.
So it's not them helping you, it's you're trying to be a dad.
Yeah.
And so yeah, those are the challenges. And I know, Dr. Rosenthal, we talk about this when you send patients home. It's so important to know that there's support on the other end. They leave your office and they go home to a really good support group. But you two have created quite a connection as well, right?
Yes.
So I think you were holding a medal, one of your marathon medals. Is that right? What's going on here?
So yeah, I didn't leave the strongman thing. I still do it. It's just modified like everything else. But I'm like, I want to challenge myself a different way. So I just started running some marathons and doing some bike races and things. And so this was my first marathon, and I owe this man essentially everything. And so I wanted to come and give him the medal of the first marathon I ran.
And it is still on my desk.
Of course it is.
Of course.
Well, and I like how he says, hey, I stopped doing the strongman and now I'm just doing some regular run-of-the-mill marathons. No big deal. So very well done. So we've been focused on sarcoma, but this was actually your second time facing cancer. You were also treated for melanoma, I understand, back in your 20s.
Right.
What was the circumstances there, and how did you get through that?
I thought I was going through a routine skin check, and at the time I was in my young 20s. I was too young and dumb to really even recognize anything, and luckily it got caught early, and so they ended up just cutting it out, and then I do follow-ups with that, so not nearly as extensive recovery or surgery as this was, but yeah, you definitely have that in your history for sure.
Yeah, the old young and dumb back in the 20s thing, we've heard that too, especially when it comes to skin cancer. But I always want to take a moment to talk about skin cancer during this time of year for sure. But I have to ask then, Dr. Rosenthal, would there be any type of connection between a cancer diagnosis in your 20s and then the sarcoma? Are they two separate issues, or any connection?
Yeah, so the answer is no. And chondrosarcoma, there really is no familial predisposition. There's no associated syndromes that are associated with chondrosarcoma, so there's really no relationship at all.
So where melanoma might come from a family history, sarcoma is just really unusual.
Yes.
That unusual.
And the reality is there are certainly fewer than, we say 500 cases, certainly less than 1,000 cases a year in the entire country. And the scapula being one of those out of any bone in the body. So you're talking about truly individual cases.
Very much so. Well, on that note, let's get to some questions from our viewers this morning. And Stu wants to know, how many of these shoulder replacement surgeries have you done?
So the this exact, I mean, I've done a lot of shoulder
We know
reconstructions
this.
and so forth, but we've probably done about 20 of the custom designed total scapula with proximal humerus replacements. The way we do it is very fascinating because now we do it by 3D printing the scapula.
Wow.
But in the old days, which is last week, we would take a CT
Exactly.
scan. That's how fast the technology is moving. We would take a CAT scan of the contralateral or the other scapula and create a mirror image of it. And then, as Zac pointed out, we create little holes or little attachment points for every muscle. And there's 20 plus muscles that we're reattaching into that scapula and the proximal humerus in order to get it to function. So we recreate the mechanics, and then we reconstruct the motors, the muscles and the tendons that move everything.
Yeah, so simple process. Yeah, all in a day for you, Dr. Rosenthal. Amy says she thought sarcomas were typically a childhood cancer. Is that true?
So sarcomas can occur in any age. There are those that occur mostly in children. For example, osteosarcoma or Ewing sarcoma. But then there are those that occur in adults. My youngest diagnosed was 3 months in utero, and my oldest that I operated on was 103. And she used to come to our sarcoma family day at the K every year, climbing up all the way to the top of the Kauffman Stadium after a major spine sarcoma surgery that I did on her.
That's a good way to kind of see how your patients are doing. That's a good test.
I'd like to say, and Zac is the example of this to the epitome, is I think my patients give me more inspiration than I could ever give to them.
I can tell.
And I like that.
I can tell by the look on your face. Stu also wants to know, how long did the shoulder surgery take? And just explain a little bit more on how it's attached to the rest of his body.
I have no idea how long it took because I wasn't checking. Do you remember? It's probably
You're not on a time clock.
It's an all-day affair.
It's an all-day thing. Yeah, exactly.
Yeah, and time just
Yeah,
doesn't
stand
mean
still.
anything at that time.
Right.
All the muscles are reattached to the prosthesis. The humeral component, the part that goes into the arm, is attached into the arm either through cement or what we call porous ingrowth, which is a coating that we put on the prosthesis that allows the bone to grow into it. The scapula, again, is supported by his own muscles that are reattached to the little holes or attachment sites that I put onto the prosthesis in the development.
Frank wants to know, are you still able to lift those ginormous weights that you were doing, or is that off limits now, or it's just lower weights?
No, I'm still training heavy.
Okay.
So yeah, just like I said before, modifying everything, still training heavy. I don't do it quite like I did just because of time factors, but not because I can't.
Dr. Rosenthal, what's the big takeaway from Zac's story?
I think inspiration is the big one. If you really put your heart, soul, and body into it, it's amazing what we can do even after reconstruction, after resection of major body parts. It's fulfilling for me because back when I first started practice, you mentioned amputation. Amputation was the standard of care. So I've had the privilege of enjoying all the new technology and have been part of it to make people better.
Make people better.
I always go back to the $6 million man, Steve Austin. We can make them run faster, we can make them stronger, we can make them be better.
I love
and
that.
As long as you keep that, you got it.
Well, and exactly, it's not like you're hearing how well your patients are doing. You're actually seeing it.
Yes.
Climb to the top of Kauffman Stadium and watching these videos of these folks getting back to life.
Exactly.
It's got to be very, very rewarding. How far up can you reach your arm? Can you?
So I'm about shoulder height there, and close to shoulder height
Yeah,
there.
that's drive-through level. You could reach through and grab your.
Yeah, stabilized, but you never want to spill your coffee
Do
or
not grab a
food or
coffee
anything
with that.
like
Yeah,
that.
you're right. That's so okay, but still, like you said, well worth it and well worth the adaptation to life. So
No doubt.
What's the other? You've talked about a lot of good takeaways today, but what do you think the biggest one is from your story?
I would say you're never alone, and don't hesitate to ask for help, and then find people in possible similar situations, and that's the biggest thing is ask for help, and then find people in similar situations and reach out, because I had people that had maybe not the exact same thing, but something similar, and still in contact with some of them, and we kind of helped each other through it because they could sense what you were going through. And so just doing that.
Yeah, inspiration reaches across all diagnoses, right?
And I still show Zac's videos to other patients in his similar situation, just again to inspire them.
Yeah.
Do I expect them to do what Zac has done? Probably not, because he really is one of a kind.
But knowing it's possible has got to be key.
Possible, exactly.
Okay. Gentlemen, thank you so much for being with us today. We appreciate it. Zac, thank you so much for sharing your story. Thanks to our viewers for being with us. We'll see you back here on Wednesday. Coming up Wednesday on Open Mics with Dr. Stites. We all get it. The couch is comfy, but getting up and getting active is the key to a healthier life. So how do you start? I'm Jessica Lovell on the next Open Mics with Dr. Stites, a beginner's guide to exercise, expert advice on getting out of your comfort zone and making fitness something to enjoy. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.